Let's talk about something that might be familiar to many of you. Have you or someone you know faced unexpected difficulties during pregnancy? Life can be unpredictable, and one of those challenges could be a miscarriage. Have you thought about the struggles people go through during such moments? How did they handle it, and what kind of support mattered the most? Share your thoughts and let's discuss this together, creating a space for understanding and kindness. Have you ever been through a tough time and felt better by sharing your story? Doctor, what are the treatments for a miscarriage? If you experience the loss of a pregnancy, the fetus must be removed from your uterus. If any parts of the pregnancy are left inside your body, you could experience infection, bleeding or other complications. If the miscarriage is complete and your uterus expels all the fetal tissue, then no further treatment is usually needed. Your pregnancy care provider will conduct an ultrasound to make sure there's nothing left in your uterus. If your body doesn't remove all the tissue on its own or you haven't started to bleed, your pregnancy care provider will recommend removing the tissue with medication or surgery. Non-surgical treatment, your pregnancy care provider may recommend waiting to see if you pass the pregnancy on your own. This may be the case if you have a missed miscarriage. Waiting for a miscarriage to start could take several days. If waiting to pass the tissue isn't safe or you wish to remove the tissue as soon as possible, they may recommend taking a medication that helps your uterus pass the pregnancy. These options are typically only available if you've miscarried before 10 weeks of pregnancy. If a miscarriage wasn't confirmed, but you had symptoms of a miscarriage, your provider may prescribe bed rest for several days. You might be admitted to the hospital overnight for observation. When the bleeding stops, you may be able to continue with your normal activities. If your cervix is dilated, they may diagnose you with an incompetent cervix, and they may perform a procedure to close your cervix, cervical cerclage. Surgical treatment, your provider may perform a dilation and curettage, D&C, or dilation and evacuation, D&E, if your uterus hasn't passed the pregnancy or if you're bleeding heavily. Surgery may also be the only option if your pregnancy is beyond 10 weeks gestation. During these procedures, your cervix is dilated, and any remaining pregnancy-related tissue is gently scraped or suctioned out of your uterus. Your provider performs these surgeries in a hospital, and you'll be under anesthesia. Doctor, what are some of the symptoms after a miscarriage? Spotting and mild discomfort are common symptoms after a miscarriage. Contact your healthcare provider immediately if you have any of these symptoms, as it could be signs of an infection, heavy bleeding or worsening bleeding. Fever, chills, intense pain. Don't put anything inside your vagina for at least 2 weeks after a miscarriage. This includes tampons, sexual intercourse. Your provider will schedule a follow-up appointment with you to discuss your recovery and any complications. Doctor, what tests should I have after repeat miscarriages? Blood tests or genetic tests might be necessary if you've more than 3 miscarriages in a row, called repeated miscarriage. These include, genetic tests. You and your partner can have blood tests, like karyotyping, to check for chromosome abnormalities. If tissue from the miscarriage is available, your provider may be able to test it for chromosome irregularities. Blood tests. You may have a blood test to check for autoimmune or hormone conditions that could be causing miscarriages. Your provider may also look at your uterus using one of the following procedures: hysterosalpingogram, an X-ray dye test of your uterus and fallopian tubes. Hysteroscopy, a test during which your provider views the inside of your uterus with a thin, telescope-like device. Laparoscopy, a procedure during which your provider views the pelvic organs with a lighted device. Doctor, how can I prevent another miscarriage? It's usually not possible to prevent a miscarriage. If you have a miscarriage, it's not because you did something to cause it. Taking care of your body is the best thing you can do. Some examples of ways to care for yourself include attending all your prenatal care appointments, maintaining a weight that's healthy for you, avoiding risk factors for miscarriage like drinking alcohol and smoking cigarettes, taking a prenatal vitamin, getting regular exercise and eating a healthy diet. You can find out detailed video on pregnancy exercise and playlist. Doctor, can I get pregnant after I've had a miscarriage? Yes. Most people, 87%, who have miscarriages have subsequent normal pregnancies and births. Having a miscarriage doesn't necessarily mean you have a fertility problem. Remember, most miscarriages occur because of a chromosomal abnormality, not because of something you did. Doctor, how soon can I get pregnant after a miscarriage? The decision on when you should begin trying to get pregnant again is between you and your pregnancy care provider. Most people can get pregnant again after they've had 1-inch normal menstrual period. Taking time to heal both physically and emotionally after a miscarriage is important. Counseling is available to help you cope with your loss. A pregnancy loss support group might also be a valuable resource to you and your partner. Ask your healthcare provider for more information about counseling and support groups. Above all, don't blame yourself for the miscarriage. Take the time you need to grieve. If you've had 3 miscarriages in a row, ask your provider about performing tests to figure out an underlying cause. You should use birth control until you receive the results. After your provider reviews the test results, they may suggest going off birth control and trying to conceive again. Doctor, how can I cope with my miscarriage? Losing a pregnancy can be devastating and leave you with a range of emotions and lots of questions. Healing emotionally from a miscarriage is often harder and longer than the physical healing. Take the time you need to grieve your loss. Talk to your partner, friends and family about your feelings or find a pregnancy loss support group online. Surround yourself with supportive people or seek professional. In the end, Nicole faced a really tough situation, losing the baby she and her husband had been eagerly waiting for. It was a difficult time, but the doctor, understanding her pain, offered support and kind words. Coping with a miscarriage is never easy, but sharing our feelings and seeking support can make a big difference. So, to all of you out there who have gone through something similar, remember, you're not alone. If you ever find yourself facing these challenges, reach out, talk to someone, because support and understanding can be a guiding light in the darkest moments. Stay strong, and know that there's a community here for you. If you found Nicole's story touching and want to stay connected with stories of strength, resilience, and support, consider subscribing to our channel. By subscribing, you become part of a community that shares, learns, and grows together. We're here for you, and your subscription keeps you updated on content that matters. Let's build a network of understanding and encouragement. Subscribe now, and let's navigate life's journey.